Welcome friends. Today in this video I will talk on medication error. If you see this prescription xylometazoline, brufen and levocetirizine, did you find anything wrong in this prescription? This contains 3 medicines but there is no antacid prescribed and it is not mentioned when to take ibuprofen, whether before or after meal. See, BD, that means twice in day, but whether after meal or before meal not mentioned. So try to understand what is the mechanism of action of NSAIDs, that means Non-Steroidal Anti-inflammatory Drugs. Here ibuprofen, it is a class of NSAIDs drug. Now how ibuprofen acts? It is mainly acts by inhibiting the enzyme cyclooxygenase, commonly known as COX. Now this COX is actually involved in the production of several kind of prostaglandin and their derivatives. Now this NSAIDs drug like ibuprofen, it actually blocks COX and the production of these prostaglandins and its derivatives are decreased. So as a result, it is used to relieve pain, used in inflammation and also help to reduce the body temperature. Now what will happen if COX is inhibited? Before going to discuss that, just I want to discuss what is the difference between COX-1 and COX-2. There are two types of enzyme which actually involved for the production of prostaglandin. They are COX-1 and COX-2. Between these two enzymes, COX-1 is involved in the production of prostaglandin, that is actually helps to protect the gastrointestinal tract, and COX-2 actually involved to produce prostaglandin, which actually causes inflammation and pain. So that means COX-1 is helpful but COX-2 is not. COX-1 helps to protect the GI tract and COX-2 causes inflammation and pain. So how gastric acid destroys our GIT, but how this stomach and intestine get protected from gastric acid? You know, there is a huge amount of hydrochloric acid produced in our GIT, but how GIT is protected from gastric acid? The answer is that our digestive tract or gastrointestinal tract actually has huge number of mucus layer there. So this mucus layer actually protects, and there is a bicarbonate, so it is basic in nature, so it can neutralize H plus, that is coming from acid HCl, and mucus layer, it is a thick layer, so it can also protect GIT from HCl. Now you see, as you know, COX enzyme is helpful to protect the GI tract by producing epithelial layer and bicarbonate. When you are taking ibuprofen, that is a NSAIDs, it actually blocks COX-1, so there will be decreased epithelial layer and decreased bicarbonate layer, so GI tract will be destroyed and there may be formation of ulcer. So that is the reason. So ulcer may be caused by NSAIDs like ibuprofen. So what precaution you may take? Take medicine after heavy meal. That means what? मेडिसिन को खाने के बाद लेना चाहिए, ठीक है. अवॉइड टेकिंग मेडिसिन इन एम्प्टी स्टोमक. एम्प्टी स्टोमक में ये लेना नहीं चाहिए. और क्या? टेक एंटासिड्स. यू नो एंटासिड्स हैज सम प्रॉपर्टी टू न्यूट्रलाइज एसिड, एंड अवॉइड यूजिंग मेडिसिन फॉर लॉन्ग टाइम. ज़्यादा दिन तक मेडिसिन नहीं लेना चाहिए. सो कंक्लूजन में क्या कहना चाहिए? इन कंक्लूजन आई कैन से NSAIDs must be taken with antacid, first one, and second one, NSAIDs should be taken after meal only. So these two mistakes, or you can say prescription error, are there. You see this prescription again, the here you see BDPCN mentioned. That means after meal that ibuprofen should be taken. So here it is rectified, but no antacid is given. So as a dose is less 200 milligram, but in previous case it was 400 milligrams. You see this one, it is 400 milligram. So it may cause ulcer. So to get protection from ulcer, this prescription should be should have another medicine, that is antacid. Okay, so I hope you understand. So thanks a lot for your valued time. I hope you like this video. Thank you.